Yes, hi, this is Dr. Khan. So as you will see, I made the cut right above. You can see the incision right here actually. And her quality of the skin is amazingly well given her age. So as you can see, I did not cut any flap out. And as you will see, if I put the skin together, it comes together. So I'm going to actually put the tattoo together exactly like it was, because I don't want to cut the skin here and the next thing you know, it's under tension and it's going to dehisce and other problems. Whenever in plastic surgery any procedure is done, it's a tension-free closure, and you can see it's coming together very nicely. And so basically the muscle is going to serve as a blood supply to this very nice, very thin, ultra thin flap, as you can see right here, and the tattoo will be preserved. I'm not cutting any of the skin. So as I go in, you will see the implant was indeed above this nice big thick pectoralis muscle, and the entire implant capsule has been removed in what is the end block technique, as you will see on the table. I dissected right here on top, and then I dissected underneath here to show this is your very nice thick pectoralis minor, pectoralis major, and as you can see there is no suggestion of what was the implant here. You can see a raw rib right here, rib, and there's no in between the two. Now there is some tissue, the scar tissue that I removed on top of over here, and as I palpate above, no scar tissue remains, especially when she was saying it was indented. I removed a lot of scar tissue from here. There was some proline suture that I saw, you will see, and as you will see inferiorly, I'm very happy with how the whole dissection has gone. I don't want to bovie all of these blood vessels, because remember the blood supply here is very tenuous, and it's essentially going to be like a skin graft over this area, if you will. And so as I go past my finger here, all soft, all inflamed tissue, suture has been removed, as you will see, and I couldn't be happier. And now what I'm going to do is I'm just going to go ahead and put this together such that it's going to lay down nicely. Blood loss was minimal, and I'm going to go ahead and put this flower, everything together exactly like it was. And as you can see, it's very appropriate tension, and the skin indeed has recoiled indeed very well. And so there you have it. No need for drains, no need to cut the mastectomy flap, and there's nothing quote overall abnormal. There was suture that was noted, scar tissue on the lateral side, and then what I would call from the previous surgeries, scar tissue that had formed, what was in this area that I removed, which I would say is consistent with the previous two other reconstructions that she had. She has had a total of 3 on this left side. So I cut out all of that. That certainly added overall to the case and the intensity and the challenge of the case. So there you have it. End block, the gold standard, and we will see how she does post-op from her indentation, the pain, the weight of the implant, many symptoms of breast implant illness, and overall her result. So I've done what is 100% total capsulectomy on the right side as well. As you will see, the very nice thick muscle, the pectoralis, the implant was sitting underneath, and what I'm going to do is continue to do that. As you will see, this is the heavy big pectoralis major muscle. The implant was above, and then when I went in, I lifted this up, and indeed there was a capsular tissue underneath. So you can see rib, and if I lift this up, you will see the dissection of the quote residual capsule was underneath, done, such that all of this inflamed tissue was removed, that capsular tissue underneath. So if I may, I'm going to go ahead and lift this up, and you can see right into that corner, complete faithful dissection all the way into that corner, such that all of that inflammatory tissue was removed. As you can see right here, all the way into that corner, you can see rib, and another rib. So all the way into this corner, you will see me, the whole pickup goes underneath. So above the muscle implant capsule, below the muscle residual capsule, all the way lateral and medial. And the other thing which is very interesting to note, the skin has recoiled very well, and despite what is a relatively large implant, and when I do put this together, She will have what is a good, nice aesthetic contour of her right chest breast area, and what is a cosmetic closure on the right side, and a flat chest aesthetic closure on the left. This is Dr. Khan, Executive Plastic Surgery.